Blood involvement in cutaneous T-cell lymphoma can occur even at early stages of Mycosis Fungoides, and by definition in Sézary Syndrome. In this video series, I will discuss hypothetical example patient cases where flow cytometry was ordered to assess blood involvement. These examples may be similar to patients you see in your practice. Let's discuss patient 3 to find out why flow cytometry was ordered. Patient 3 is a 60-year-old man who was initially diagnosed 4 years ago with a stage 3B erythrodermic mycosis fungoides. At diagnosis, he presented with skin stage T4 defined as diffuse erythroderma over 80% of body surface area. There was also no evidence of nodal or visceral disease. Flow cytometry utilizing a T-cell panel revealed a low level of abnormal T-cells consistent with B1 blood involvement. His most recent treatment was extracorporeal photopheresis and injections of pegylated interferon. Partial response in the skin was maintained for roughly 12 months, but now the efficacy is waning with recurrent erythroderma and pruritus. While this patient did not fulfill diagnostic criteria for Sézary syndrome at diagnosis, in my experience, relapsing erythroderma in patients with a history of blood involvement may indicate that his disease is evolving from erythrodermic mycosis fungoides to the leukemic CTCL variant Sézary syndrome. Worsening erythroderma and pruritus may be a warning sign of increased risk of disease progression. Currently, the patient is experiencing worsening skin symptoms, intense and intractable pruritus, and erythroderma with acral fissuring and hyperkeratosis of his hands and feet. Mild palpable lymphadenopathy was also noted, and he reports weight loss and persistent fatigue and malaise. All these signs and symptoms raise suspicion of disease progression and would prompt further investigation, including a full blood workup, including complete blood count with differential, complete metabolic panel, LDH, and repeat flow cytometry analysis using a T-cell panel that includes the 6 recommended T-cell markers. Including CD4 and CD8 markers is important for determining T-cell subsets. This will also help determine the CD4-CD8 ratio, which can provide additional relevant information. So what are the clinical flags that would lead me to refer this patient for repeat blood flow cytometry? In this case, the patient had signs of disease progression, including intractable pruritus, worsening erythroderma, and lymphadenopathy. His constitutional symptoms, specifically weight loss, fatigue, and malaise, were also concerning to me. This patient was refractory to current treatment. In my experience, the initial detection of an abnormal blood flow result at diagnosis was also an important consideration. For consistency, I would send the blood samples to the same flow cytometry lab that performed the previous analysis in order to minimize potential variability due to different methodologies across centers. Let's take a look at the flow cytometry results. Comparing results from the last report to the current one showed increased blood involvement with approximately 3,500 Sézary cells per microliter, as indicated by the absolute cell counts of CD4 positive, CD7 negative, and CD26 negative T cells. Additional abnormal parameters were lymphocytosis and a high CD4 to CD8 ratio equal to or higher than 10:1. These findings indicate evolution to B2 blood classification, which is a defining criteria for Sézary syndrome. In my practice, this patient would be started on a new systemic therapy, and the repeat monthly blood analysis, including flow cytometry, would be scheduled to assess his response to the treatment. In closing, keep in mind these clinical considerations and recommendations related to this patient's case. Blood involvement can develop at any stage of Mycosis fungoides and can progress to the leukemic form of CTCL, which has been associated with poor outcomes. Consensus guidance recommends routine evaluation of blood by flow cytometry every 3 months, if feasible, in patients who have abnormal flow cytometry results at baseline. In addition, it's important to routinely monitor blood by flow cytometry to help assess response to treatment and to help guide treatment approach. Thank you for watching. I hope this information is useful. For more information, including additional patient cases, explore probeinctcl.com.